For our beloved seniors and their families, the simple daily act of taking a bath or shower is surrounded by whispers of danger and worry. But what's the real truth? Today, we're uncovering the essential, and yes, sometimes shocking facts everyone over 70 needs to know. This isn't about fear, it's about empowerment and safety. Fact 1. Skin becomes 50% thinner after 70, making it incredibly fragile. Hot water and harsh soaps don't just dry it out, they can cause microscopic tears, opening the door to infection. Fact 2. The primary risk isn't the bath itself, but the fall. Over 80% of senior falls happen in the bathroom. A wet, slippery surface is the single most dangerous place in the home. Fact 3. The body's internal thermostat falters with age. Seniors are far less likely to feel that water is scalding until serious burns have already occurred. The maximum safe water temperature is 120 degrees Fahrenheit or 49 degrees Celsius. Fact 4. Total bed baths or sponge baths are not actually safer. In fact, failing to rinse soap completely off fragile skin can lead to severe irritation, rashes, and, even bacterial buildup. Fact 5 is all about bathing frequency. And it might surprise you to learn that bathing every single day is not only unnecessary for most seniors, but it can actually be harmful to their skin and overall well-being. Many people grow up believing that a daily shower or bath is essential for good hygiene, but as we age, our bodies change, and so do our needs. The skin of older adults becomes thinner and more delicate, making it more susceptible to dryness, irritation, and even small tears or cracks. This means that the habits we had in our younger years may not be the best choice as we get older. In fact, the skin's ability to retain moisture decreases with age, and the natural oils that once kept our skin supple and resilient are produced in smaller amounts. This makes older adults more vulnerable to the effects of frequent washing, especially when harsh soaps or hot water are involved. It's important to recognize that what worked for us in our 20s or 30s may not be suitable in our 70s or 80s. For many seniors, adapting to these changes can feel strange at first, especially if they've always associated daily bathing with feeling fresh and clean. But understanding the unique needs of aging skin is the first step toward maintaining both comfort and health. For most seniors, a full bath or shower just 2 to 3 times per week is more than enough to maintain proper hygiene. This frequency helps keep the skin clean without stripping away the natural oils that protect and moisturize it. In fact, overbathing can actually do more harm than good, leading to dry, itchy, or even cracked skin, which can be uncomfortable and increase the risk of infection. It's important to remember that personal hygiene isn't just about frequency, but also about the methods and products used. Gentle, fragrance-free soaps and lukewarm water are best, as hot water and harsh cleansers can further dry out the skin. Seniors who have mobility challenges or need assistance with bathing can benefit from using shower chairs, grab bars, or handheld shower heads, which make the process safer and more comfortable. Caregivers and family members should approach bathing routines with sensitivity and respect, always prioritizing the senior's dignity and preferences. It's also helpful to establish a consistent bathing schedule so seniors know what to expect and can prepare accordingly. This can reduce anxiety and help make bathing a more positive experience. On the days between full baths or showers, a simple pits and parts wash at the sink is a great way to stay fresh and clean. This means focusing on areas that tend to sweat or collect bacteria, like the underarms, groin, and feet. Using a soft washcloth and mild soap, seniors can easily maintain their hygiene without the need for a full bath. This approach not only saves time and energy, but also helps preserve the skin's natural moisture barrier, which is especially important for older adults. In addition, this method can be empowering for seniors who wish to maintain their independence, as it's often easier and less physically demanding than a full shower or bath. Family members and caregivers can encourage this routine by making sure that all necessary supplies, like gentle cleansers, soft towels, and washcloths, are easily accessible. It's also a good idea to remind seniors to pat their skin dry instead of rubbing, as this is gentler and helps prevent irritation. By making these small adjustments, seniors can feel clean and comfortable every day, even if they aren't bathing in the traditional sense. Overbathing actually strips away those vital protective oils that keep the skin soft and healthy. When these oils are lost, the skin can become dry, flaky, and more prone to irritation or even infection. That's why it's so important for seniors to moisturize after bathing, using a gentle, fragrance-free lotion to lock in hydration. Moisturizing right after bathing, while the skin is still slightly damp, helps seal in moisture and provides lasting comfort. Seniors should pay special attention to areas that tend to get dry, such as the arms, legs, and back. If you or a loved one are unsure about the best bathing routine, don't hesitate to consult with a healthcare provider or dermatologist. They can offer personalized advice based on individual needs and skin conditions. In some cases, a professional might recommend specific products or routines tailored to sensitive or problem-prone skin. Remember, good hygiene is about balance, keeping clean while also protecting the skin's natural defenses. By adjusting bathing habits to fit the needs of aging skin, seniors can stay comfortable, healthy, and confident every day. Taking the time to care for the skin isn't just about appearance, it's about overall well-being, self-esteem, and quality of life. With the right approach, bathing can be a soothing, enjoyable ritual that supports both physical and emotional health as we age. Okay, here's fact number 6. Scented bubble baths, Epsom salts, and a lot of those popular soothing products are actually pretty acidic. They can mess with your skin's delicate pH balance, which, can lead to some really painful conditions like dermatitis. Now let's talk about fact number 7. This one is especially important for anyone who enjoys a relaxing soak in the tub, but it's also something that many people don't realize until it happens to them. Standing up after a bath might seem like a simple, everyday action, but for seniors it can be surprisingly challenging and even risky. The bathroom, with its warm water and smooth surfaces, is a place of comfort, but it can quickly become a place of danger if you're not careful. Many people underestimate just how much effort and coordination it takes to get up safely, especially as we age or if we have mobility issues. The act of standing up, which we do countless times a day, suddenly becomes a test of strength, balance, and awareness. The moment you stand up after a bath, your body is suddenly forced to adjust. Warm water causes your blood vessels to dilate, which means your blood pressure is already a bit lower than usual. When you go from sitting or lying in the tub to standing, your cardiovascular system has to work extra hard to pump blood up to your brain and throughout your body. This sudden change can put a huge strain on your heart and blood vessels, especially if you're older or have underlying health conditions. Even if you feel fine while sitting in the tub, the transition to standing can catch you off guard. Your muscles, which have been relaxed by the heat, may not respond as quickly as you expect. The combination of slippery surfaces, wet skin, and a relaxed body can make it much harder to maintain your balance. For some, just the act of shifting weight from one foot to the other can feel like a major challenge. There's a real risk here of what doctors call a sudden drop in blood pressure or postural hypotension. This happens when your body can't adjust quickly enough to the change in position, and blood momentarily pools in your legs instead of reaching your brain. The result? You might feel lightheaded, dizzy, or even like the room is spinning. For some, it can be so severe that they experience a brief blackout or lose consciousness altogether. This isn't just a minor inconvenience, it can be a frightening and dangerous experience. Imagine standing up only to have your vision blur and your knees buckle. In that split second, you're at risk of falling, and the hard surfaces of the bathroom offer little protection. Even if you don't faint, the sensation of dizziness can linger, making it difficult to take those first few steps out of the tub. It's a moment when your body is vulnerable, and your mind needs to be fully alert to avoid an accident. These symptoms can be frightening, especially if you're alone. You might suddenly need to sit down quickly to avoid falling, or you may have to grab onto something sturdy, like a grab bar or the edge of the sink, just to keep your balance. In some cases, people feel so unsteady that they have to remain seated for several minutes before they can safely move again. This is your body's way of protecting you, but it's also a clear warning sign that you need to be careful. It's important to listen to your body and not rush the process. Taking a few deep breaths, moving slowly, and making sure you're fully steady before taking a step can make all the difference. If you ever feel unsure, it's always better to wait a moment or call for help rather than risk a fall. Remember, your safety is more important than getting out of the bathroom quickly. The danger doesn't stop at dizziness. If you lose your balance, there's a real risk of slipping or falling, especially in a wet and slippery bathroom. Falls in the bathroom are one of the leading causes of injury among seniors, and they can have serious consequences, from bruises and sprains to broken bones or even head injuries. That's why it's so important to take precautions, like installing grab bars, using non-slip mats, and making sure you have help nearby if you need it. Even small changes like keeping a sturdy chair or bench within reach can make a big difference. If you have a history of dizziness or balance problems, talk to your doctor or a physical therapist about strategies to stay safe. Remember, standing up after a bath isn't just about getting out of the tub. It's about keeping yourself safe and healthy for many more relaxing baths to come. Taking a few extra moments to ensure your safety can help you enjoy your bath time with peace of mind, knowing you're doing everything you can to protect yourself. When it comes to bathroom safety, one of the very first things that comes to mind is the non-slip mat. And for good reason, these mats are specifically designed to provide extra grip and stability, especially in areas that are prone to getting wet and slippery, like the bathroom floor or inside the shower. For fact number 8, let's take a closer look at non-slip mats. They're not just a convenience. They're an essential safety feature, and they absolutely play a crucial role in preventing slips and falls, particularly for seniors, children, or anyone with mobility challenges. The textured surface of a non-slip mat can make a significant difference, giving your feet something to grip onto instead of sliding on smooth, wet tile. This is especially important in homes where multiple generations live together, as both the very young and the elderly are at higher risk for bathroom accidents. You'll find a wide variety of these mats in stores, ranging from simple rubber mats to more advanced designs with powerful suction cups that keep them firmly in place even when the floor is wet. Some mats are made with eco-friendly materials, while others are designed to be extra thick for added comfort underfoot. There are even mats with built-in drainage holes to help water flow through, reducing the risk of puddles forming on top. Some non-slip mats also have antimicrobial properties to help prevent mold and mildew, which is a nice bonus in a damp environment like the bathroom. This means you don't have to worry as much about unpleasant odors or the health risks associated with mold growth. When choosing a non-slip mat, it's important to consider the size and shape of your bathroom or shower area. Mats come in all sorts of shapes, rectangular, oval, or even custom cut to fit around fixtures. Make sure the mat covers the areas where you're most likely to step, and check that it stays securely in place. A mat that bunches up or slides around can actually become a tripping hazard, so always test it before regular use. And don't forget to clean your mat regularly, as soap scum and grime can build up over time and reduce its effectiveness. But here's the thing, while non-slip mats are a great first step, they're just not enough on their own. Bathrooms are one of the most common places for falls to happen, and unfortunately, a mat can only do so much. The single most effective safety device you can add to your bathroom is a properly installed grab bar. Unlike a mat, which only helps when you're standing on it, a grab bar provides sturdy support whenever you need to steady yourself, whether you're stepping in or out of the shower, lowering yourself onto the toilet, or just moving around the bathroom. Grab bars are specifically designed to support your weight and are anchored securely into the wall, so you can trust them to hold up when you need them most. They come in a variety of shapes and finishes to match your bathroom decor, and some even have textured grips for extra security. If you're not sure where to install them, a physical therapist or occupational therapist can help you figure out the best locations based on your needs and routines. For example, some people benefit from having a vertical bar near the shower entrance, while others might need a horizontal bar along the back wall. There are even fold-down grab bars for smaller spaces or for use next to the toilet. The key is to think about your daily habits and where you're most likely to need a little extra support. And remember, professional installation is always recommended to ensure the bar is anchored into a stud or with proper hardware, so it can truly support your weight in an emergency. It's important to remember that not all bathroom fixtures are created equal. For example, towel racks might look sturdy, but they're not designed to support a person's weight. If you try to use a towel rack for balance or to catch yourself during a slip, it can easily pull right out of the wall, leading to a dangerous fall. This is a common mistake, and unfortunately, it's one that can have serious consequences. That's why it's so important to have real grab bars installed wherever you might need extra support. In summary, while non-slip mats are a helpful addition to any bathroom, they should be seen as just one part of a comprehensive safety plan. Pair them with properly installed grab bars, and you'll create a much safer environment for yourself or your loved ones. Taking these simple steps can make a world of difference in preventing accidents and giving everyone peace of mind. Remember, bathroom safety isn't just about preventing falls. It's about maintaining independence, confidence, and comfort in one of the most important rooms in your home. By being proactive and thoughtful about your bathroom setup, you can help ensure that everyone, regardless of age or ability, can use the space safely and with dignity. Fact number 9, dehydration risk really skyrockets during a hot bath. Seniors should, drink a full glass of water before and after bathing to help maintain blood pressure and prevent dizziness. Fact number 10. Morning might actually be the most dangerous time to bathe. Stiff joints, lower blood pressure, and, residual sleepiness from medications all increase the risk of falls. Late morning or afternoon is often a safer choice. Fact number 11. Installing a walk-in shower or a transfer bench isn't just a luxury, it's really a critical medical safety intervention that can help prevent a life-altering hip fracture. Fact 12. Ignoring toe fungus or dry, cracked heels isn't just a cosmetic issue. In the warm, moist environment of a bath, these problems can actually become portals for serious systemic infections. Fact 13. The bathroom should be warm, at least 75 degrees Fahrenheit or 24 degrees Celsius. Cold air on wet skin can, cause a dangerous spike in blood pressure as blood vessels constrict rapidly. Fact 14. Shower chairs are for everyone, not just those with mobility issues. They help prevent fatigue and instability, allowing for a safer and more thorough cleaning experience. Fact 15. And maybe, the most surprising of all. The greatest benefit of bathing isn't actually physical, it's psychological. The sense of dignity, independence, and well-being that comes from a safe, comfortable bath is truly immeasurable for mental health. The goal here isn't to stop bathing, it's really to make it safe. So, the conclusion is clear. Seniors should absolutely take baths, but they must transform the ritual with knowledge and the right tools. Safety first, but, dignity always. Honestly, this information can save a life. Please, Share this video with every senior and caregiver you know. Spread this knowledge in your family groups and community circles because it really matters. For more vital, evidence-based advice for thriving at every age, subscribe to our channel and hit the notification bell. Your health and independence are, without a doubt, worth it.